Today I'm really pleased to speak to the Health Insurance Amendment Professional Services Review Scheme Bill 2023. This bill implements changes arising from the recommendations of the Phillip Review, an independent review of Medicare integrity and compliance conducted by Dr Pradeep Phillip of Deloitte Access Economics. The review was undertaken at the request of the current Minister for Health and Aged Care, with its purpose being to focus on the payment system of the Medicare Benefit Schedule, the MBS. The 5 terms of reference for the review of the MBS were broadly to look at high-level ways of reducing fraudulent behaviour, integrity risks around payment and claiming channels, non-compliant or over-servicing risks, ways of improving the practitioner review program and professional services review functions, and a review of the Health Insurance Act to identify potential improvements to strengthen both compliance and penalties for fraud and inappropriate practice. Importantly and alarmingly, the Phillip Review concluded that, in relation to our current Medicare system, legislation, governance, systems, processes and tools are currently not fit for purpose, and that without significant attention, that they will result in significant levels of fraud. These governance failures are real and they are concerning. Unsurprisingly, the recommendations arising from Dr Phillip's review were wide-ranging, but they can be categorised into 4 broad areas: governance and structure, operational processes, modernising technology and strengthening legislation. These are all very important recommendations, but today's bill addresses only a small fraction of them. Firstly, this bill removes the requirement for the Australian Medical Association, the AMA, to agree to the appointment of the Director of Professional Services Review, the PSR. This recommendation was made on the basis that the current arrangement is inconsistent with public expectations regarding the independence of the Professional Services Review. The Phillips Review recommended removing this veto power because of the breadth of the health professionals whose members are now potentially susceptible to review by the PSR. The fact is that a veto power from the AMA, a single professional body, no longer reflects the fact that there are a wide range of professionals who could potentially be referred to the PSR. The review described this veto as an anachronism, which has never been exercised, and considered that its removal could bring about a measurable enhancement to the perception of the PSR, both by the sector, but also that it could remove perceived conflicts of interest. I have to note that recently I met with the Consumer Health Forum, which noted that there's also no consumer representative on the PSR, despite the clear advantages and documented impact on health and on medical research. Consumer involvement is often undercooked in our governance and administration structures. I believe that addition of a consumer representative to the PSR would add an additional important voice. It would give comfort to patients and to their families that the issues considered by the PSR include their perspectives and inform the PSR's responses. The bill also amends consultation requirements for appointing other statutory office holders of the PSR to enable consultation with relevant peak bodies directly rather than via the AMA. That seems entirely appropriate. It makes no sense that an external advisory body, a peak body of medical professionals, of doctors, can really exercise any other veto power or effect over other office holders of the PSR. The bill establishes a new statutory office of the Associate Director of the PSR, who will assist with managing conflicts of interest and workload pressures. That Associate Director will have the same functions and powers as the Director in reviewing inappropriate practice, but will not have a role in administering the PSR agency. To streamline the audit process, the bill removes the requirement for the Chief Executive of Medicare to consult with relevant professional bodies prior to issuing a notice to provide documents. This will ensure clear and accountable natural justice to the regulated entity under investigation without unnecessary involvement of a non-regulated entity. It has to be said that these amendments to the bill, worthy that they are relatively confined. They're very modest when viewed in the context of the very wide-ranging recommendations set out in the Phillip Review. Indeed, Dr Phillip sets out a 10-year plan, 10 years, for ongoing continuous improvement initiatives and activities within the Medicare benefit schedule. Whilst we can look forward to this ambitious reform agenda being addressed in future policy development and legislation, rather than concentrating on each of those recommendations and the journey towards widespread Medicare reform, our focus should really be on the broader conclusion drawn by Dr Phillip, that the governance of Medicare, as the Minister has said, as the member for Debelle has already told us, is out of date, and Medicare is in its worst shape in its 40-year history. As Dr Phillip has said, as the health system has evolved, government is now inadequate. It's running the risk of piecemeal approaches to compliance, piecemeal approaches to fraud, and it has no holistic understanding of major trends in the nature of healthcare delivery. This is deeply disturbing. A sound and well-functioning compliance and integrity system is critical for all Australians. We have to give Australians trust in the Medicare system and, by extension, in our health system. We have also to ask ourselves, what does integrity in our health system look like? As we've seen in recent days, trust in the integrity of our governments and the system of our government is taking a battering, day by day, month by month. The report released last week by the Australian National Audit Office, the ANAO, into the $2 billion Community Health and Hospitals program wasn't just scathing, it was utterly damning. The point of that ANAO audit was to assess the effectiveness of administration and compliance within the grants and rules of the CHHP. The audit found that executive oversight, risk and fraud management in that scheme were deeply deficient. Only 2 of 171 programs in the CHHP were highly suitable. The Health Department was found repeatedly to have fallen short of ethical requirements and to have repeatedly deliberately breached guidelines in dispersing taxpayers' funds. In some cases, the department administered grants that it first found out about from ministerial press releases. More than $1 billion of taxpayer money was allocated from what was essentially a ministerial slush fund, and we only found out about it after the fact, 5 years later, after the money was gone. This is why I am deeply concerned about the Phillip Review's 10-year timeline for administrative change. We need stronger mechanisms now. We need stronger legislative mechanisms to ensure that substandard funding allocations and deliberate breaches of the Medicare system are prevented, not identified 5 years after the fact. And when those breaches do occur, as they inevitably will, they should be identified quickly and bad actors penalised accordingly. The practices illuminated in the ANAO's report, and to a lesser but still concerning extent in the Phillip Review, have had the unfortunate effect of eroding public confidence in our healthcare system. Somewhere along the line, some people who work for our Commonwealth have forgotten that the Commonwealth must use and manage public resources, all of our public resources, properly. Properly in this context means efficient, effective, economic and ethical use of taxpayers' money. And when we see that in this light, we have to ensure that the executive oversight, risk and fraud management of our Medicare system does not fail, as it clearly has for the CHHP grants program. Trust in government is at an all-time low. We have to do what we can to restore it. Our Medicare system is world-class. It supports the health of every Australian, but it needs world-class governance and oversight to keep it strong and to make sure that it is fit for purpose. Dr Phillip makes the observation that the overwhelming majority of health practitioners are well-meaning and ethical people, concerned primarily for the health and welfare of their patients. I could not agree more. But the system that they inhabit, in which they work, is no longer fit for purpose. We have to have one that's not reliant solely on the goodwill and altruism of health professionals to properly manage our public resources and meet the needs of the Australian people. Our Medicare system desperately needs to adapt to changing health needs and to health services delivery. Australians deserve to be able to trust in Medicare. Our young and future generations have to be assured that it will be there for them. Sunlight is the best medicine, and we need it now to ensure that our Medicare system and our health system more broadly remains an international exemplar for what modern healthcare should look like. I commend this bill to the House.